little short. Okay. Hi, my name is Dena Goldberg, and I'm a board-certified genetic counselor and content creator.
So, who is genetic testing for?
Yeah, so genetic testing in general, there's a lot of uses for it. But when we're talking about the cancer setting, there's different types of genetic testing. And the type that I specialize in is called germline genetic testing. So that's looking at the genetic code that someone's born with, trying to determine if they have an increased risk for developing a tumor or a cancer. So who's it for? This is a great question. So if you think about technically what a lot of these medical organizations are saying, they have all these guidelines about people who have family history, people who are diagnosed at a young age. But we're getting to the point where everyone with cancer really can benefit from some sort of genetic testing. And I think we are also moving towards population-based testing where everyone's just going to get it eventually. But for now, it's specifically for people, especially when they are diagnosed young, when there's any family history, or if they don't know their family history. And if they're diagnosed with a rare type of cancer, then genetic testing may benefit you.
How can you find out what your test results mean?
I, as a board-certified genetic counselor, am specifically trained in interpreting the genetic test results for patients. So that involves partly science communication and partly seeing this patient where they are, meeting them where they are, and making sure that they are able to take that information and really use it and create an action plan. Yeah, so I recommend anyone who has had a genetic test and doesn't understand their results or is considering having a genetic test, meet with someone like me, a genetic counselor. We are all over, and insurance typically covers our services, and if they don't, there's ways to get it, financial aid or cash pay options. So just like any other specialist, we're there for you specifically to help with your genetic testing needs.
And talking about that access point, if someone's told, oh, you don't qualify, what should they do with that information? Is that true?
It depends. So I have definitely seen patients who did qualify. Physicians or care team told them they didn't. So maybe asking more than one provider, looking up guidelines is going to be helpful. And if you truly don't qualify, but you would like to have genetic testing, I believe personally that anyone who would like to have it should have access to it. So the cash pay rate if someone doesn't qualify for insurance coverage is typically no more than $250. So if you don't qualify for genetic testing but are still interested in it, I would recommend doing it through, again, a genetic counselor or medical professional, and you can ask about the cash pay rate and pay out of pocket or use financial aid if needed.
I would love to just get back to that point of anyone who wants it should get it. Why is that something you believe in so strongly?
Yeah, I think that you are the main person responsible for your own body, right? You are the one that's really looking out. I have had patients who didn't meet these criteria or guidelines that these organizations have set for many different reasons. Sometimes they don't know their family history. Sometimes it's like just there, but not there enough to get coverage. And sometimes they're just curious and they have anxiety about it and they just want to know. And I think it's a right for us to know information, and the technology exists. And so if somebody wants it, I think anybody who really wants it should be able to access it in a way that is ethical and appropriate for them, which is why I always, even if someone doesn't fit criteria, I always make genetic testing available for them. Part of that is because I would want that in their shoes. So when I put myself in someone's shoes and I don't qualify for something that I feel will give me peace of mind or information, I want them to be able to get that information. And I have seen patients that didn't qualify, as I was saying before, that ended up being positive and actually having a disease-causing variation, but they didn't fit criteria because of one thing or another. And if they hadn't self-paid, they would never have known that information. Or if they hadn't gotten financial aid or they hadn't pushed for it, they wouldn't have gotten that information. So because I've seen that a number of times, and because our guidelines aren't perfect, I think, again, everyone should have the right to their information.
So for those of whom who either have a breast cancer diagnosis, have a family member with a breast diagnosis, we often think of the BRCA1 genetic variant. Can you tell us a little bit about testing beyond?
Yes, so for breast cancer specifically, we know BRCA1 and 2 are these big heavy hitters, but there are also a handful of other genes, some that will also confer a very high risk for developing breast cancer at an earlier age, some that will have a moderate risk or be associated with a slightly lower risk, but still high enough that we would want to change somebody's medical plan. If somebody has a gynecological cancer, specifically ovarian or uterine cancers, those can be associated with several different syndromes. The most common is something called Lynch syndrome. And it's actually the most common hereditary cancer syndrome. People don't talk about it a lot, but it confers a higher risk for gynecological colon cancer and other GI cancers and a few other things. And so knowing that information is super important. There's a lot of prevention we can do, or at least risk reduction that we can do for Lynch cancers. And most people who have Lynch syndrome don't know they have it. So there's a lot of people walking around with it, or a lot of people that were tested just for BRCA that don't know they actually have Lynch syndrome, which is a condition with a lot of action to take. And if it's one of those other syndromes, there's also a lot of interventions we can take to lower someone's risk of cancer. So for gyne cancers, uterine, ovarian, it's super important to make sure that you were tested with a large panel looking at all of the genes associated with gynecological cancers. And the thing is, it's the same price to be tested for 1 gene or 100 genes because of the technology that's used. So it makes sense to be tested for a bigger panel. It's not about price. It's about the information that we can get from it. So definitely more than just BRCA. If you haven't been tested for more, you should definitely ask, especially if you are negative and you have a strong history or family history.
And if someone's already been tested?
Yeah, and if you've already been tested, you can get an updated panel. Typically, we can get it covered by insurance, and there are pretty easy ways to get that, depending on what lab it was done and how many genes were tested. But again, if not, the self-pay rate should never be more than $250, and that's for a big panel of these genes. And it can be done with blood or saliva, so you can even do it from the comfort of your own home by sending in your saliva sample. So if you are someone who's interested in seeing someone like me, a genetic counselor, you can go to a website called findageneticcounselor.com to find one locally. We work at many academic centers, most academic centers, and then many community clinics. And then there's also telemedicine genetic counseling. So there are different companies that provide that. Sometimes the laboratories will provide free genetic counseling, but I do recommend if you want more time with a genetic counselor to try to see one in person or see one through telemedicine that allows you to have a longer time to really connect with them and talk to them about your results or about your interest in genetic testing.
Can you only see a genetic counselor when you're being tested, or can you start seeing more?
Oh, good question. Yeah. So not everyone who comes in for genetic counseling walks out of there with a genetic test. Sometimes we find that it may not be the right time in someone's life because of things that are going on, or where they are mentally or emotionally, or maybe they want to wait to know the information. Maybe they want to buy life insurance first. So there's a lot of reasons that somebody may not test right away. And sometimes people just want to talk about their options and what it would mean if they were positive or negative before they undergo a test. So genetic counseling is separate from genetic testing, which they often are grouped together, but you can absolutely see a genetic counselor without getting genetic testing. And it is all up to you. It's all about choice. So whatever you feel is right for you, and as long as you are given all the information to make that decision for you.
How can breasties debunk health information on socials? What should they be looking out for?
Yeah, so it's really important, first of all, not to share information if it's not from a credible source, because you're just contributing to the misinformation sharing. So making sure it's from a credible source is really important. And how do we do that? A credible source is somebody that is educated, typically has gone to school for this for many years, has the degrees to be educated enough in it, and practices in the area, and or researches in it, is literally living it. Those are the people who are going to be the most knowledgeable about anything that has to do with cancer. And so there's lots of different people that could fall into that category. But there are plenty of people on social media who don't have credentials, who haven't gone to school for it, who maybe got a random certificate. And those people are not going to have the information or even the ability to translate science in an accurate way to then use for the general public. And so it's important to see what the credentials are, what their degrees are, what their personal career experience is, what their research is in, and what they do and why they're talking to you. So that's the other thing. If they're trying to sell you something, chances are it's probably not super credible. I think generally that's the thing. So if they're trying to educate you, and a lot of it you'll feel out too. So you can tell when someone's trying to sell you on something or kind of making stuff up that seems out of the question.